Did you know that heart disease affects both men and women differently? It's true, and understanding these differences can be a matter of life and death. When it comes to symptom presentation, men and women can have very different experiences. Chest pain is a common symptom for both, but women are more likely to experience shortness of breath, nausea, and fatigue. They might not always exhibit those dramatic chest-clutching moments you see in the movies. Now, let's talk about age. Heart disease tends to show its face later in life for women. This is largely due to the protective effects of estrogen, which women lose after menopause. But don't be fooled, younger women can still be at risk, especially if they carry risk factors like diabetes, a smoking habit, or a family history of heart disease. Speaking of risk factors, some pose a different threat to women than they do to men. Diabetes, for instance, presents a greater relative risk for heart disease in women. And conditions like polycystic ovary syndrome and pregnancy complications can also impact a woman's heart health. When it comes to coronary artery disease, women are more likely to experience microvascular disease, which affects the smaller arteries, while men often have obstructive coronary artery disease in larger arteries. This can make detecting heart disease in women a bit more challenging, as traditional diagnostic tests might not always pick up on microvascular disease. And of course, we can't forget about the way women respond to treatment. It can be different from men, and ongoing research is helping us understand these differences and tailor treatments accordingly. Unfortunately, there's a common misconception that heart disease is a man's problem. This can lead to underdiagnosis and undertreatment in women. It's crucial to raise awareness about these gender-specific symptoms and risk factors. Hormones also play a part. Changes associated with pregnancy and menopause can influence a woman's heart health. Even hormone replacement therapy during menopause can have implications for heart disease risk. The key takeaway here is that both men and women need to be aware of their individual risk factors for heart disease. Adopting heart-healthy lifestyles, getting regular checkups and screenings, and having open discussions with healthcare providers can all contribute to managing these risks early on. And as research continues to shed light on the gender-specific aspects of heart disease, we can expect improved prevention and treatment strategies for everyone. So don't wait. Take care of your heart today, because your heart is worth it.